Hi, this is Dr. Goldkamp of the Keto Naturopath. Today I wanted to go over some things that I think have been misrepresented in a number of YouTubes, and how I come to this information, as fascinating as it is primarily our clients and patients come back to me and say, is this true? Can you answer this? Can you straighten this out? So I'm going to straighten this out now. We're going to talk about vitamin D, what it is, how it's made, how to use it, and how do you know if you need it. And then we'll go into a little bit into the politics of reporting vitamin D. Okay? So bear with me. So the first thing I want to go over is, is vitamin D a steroid? Is vitamin D a hormone? Or is vitamin D a vitamin? I can't say that it's all three, and I'm going to tell you why, but the issue of whether it's a hormone or a vitamin, I don't really care. Call it chocolate-covered plywood. It's relevant, it's important, and this is how we talk about it. So I find there's a lot of conventional doctors that really try to pretend they know a lot about this by saying that, oh, of course it's a hormone. Well, then of course it's a hormone. And others saying, of course it's a vitamin. So it's not an issue that's really worth anything to me. Okay, so here we are. We're looking at vitamin D. And what I want to show you is vitamin D. These are the steroids, right? So steroids are your sex hormones, are things that are derived from cholesterol. So you have cortisol, corticosteroid. Anyway, it goes on from there. But this is vitamin D. You'll notice that it does not look like a steroid. It looks similar, but it's not the same. And I hope you do notice this, because then it is called a secosteroid or a secosteroid. And what that means, seco is Greek, I believe, to cut. And so if you take this model up here as cortisol and you cut the B ring, that's A, B, C, D, cut the B ring, you're going to get something like this. It sort of unravels a little bit. So it's loosely can be called a steroid. It's a secosteroid, a cut steroid, if you will. And there's others that actually belong to a whole other family. So I find that that's the first kind of incorrect piece of information out there. It is not a steroid. It's a secosteroid, and it's a derivative, not from cholesterol. So I should say it is from cholesterol, but it's so far removed that it's pretty remote. Okay, let's go on. The other thing I want to bring up is that when we measure, and we will look at actual labs at the end of this, when we measure vitamin D has two kinds of vitamin D that you can measure as a lab. And I used to measure both, and it's a totally worthless thing to do. You don't need to measure both. But I want to explain why there are two lab for vitamin D and what they mean, and so you don't get confused, because you'll find if you bring this to your doctor and he has no idea what vitamin D is, you will have to instruct him or her what to do. Okay, so let's look. Here you go. So vitamin D does start with sunlight and it hits your skin, and it really is a fascinating story. It basically makes vitamin D3, otherwise known as cholecalciferol. Okay, you don't really need to know that either, but it still is not completely active or useful for the body. It needs to be acted on the liver, and so when it gets acted on by the liver, it's a thing called 25-OH vitamin D. Sounds technical, don't get thrown. 25-OH vitamin D. All my patients know that. Please don't get stuck on it. All right, but then it goes to the kidney and it gets converted into the active form, 125-OH2, should you want to know. Okay, so blood tests. You can get blood tests on 25-OH vitamin D, and you can get blood tests, labs, on 125-OH2. Which is the one you need? If this is the active one, isn't that the one that's much more important? Well, technically, you're right. It is the one that it actually is the active form of vitamin D, or vitamin D3, if you will. But it has a half-life. In other words, that levels stay at whatever point you measure it for about 15 hours. It's a very short period of time. Whereas what they use, and what you should use, is 25-OH vitamin D. This is more about your vitamin D reserves. This actually lasts at this level. Whatever level you measure it at, it lasts for about 15 days. So it's a huge difference. One is very fast and what they call a short half-life, length of time that it stays at that level in your bloodstream, and the 25-OH. Okay, so this is the lab that you want, 25-OH, not the 125-OH. And if anybody starts talking about that, it's really irrelevant. The research is not very deep on this, and there's nothing in the way of reserves. It's just a moment in time, a very specific moment in time, whereas you measure 25-OH, it's a much more sustained period of time, and it is representative of your reserves, okay? All right, now we're moving on. So what is the other confusion? We hear about vitamin D2 and vitamin D3. Well, vitamin D3, cholecalciferol, you make. I just said that. And animals make that make vitamin D. Ergocalciferol comes from plants. And so technically people can say, well, you can get vitamin D from eating plants. It's mostly mushrooms. And it is in such low amounts, minuscule amounts, you would have to eat a truckload of mushrooms. I don't know if it's chanterelles or white mushrooms, but you can look that up. It's not that essential to me. But it's not technically untrue. I mean, there is a thing called ergocalciferol. It is in such small percentage that it just is impossible. So I would say, no, you can't get it from plants. But I've just given you the qualification on that. Where most people have gotten it, outside of making it, if they weren't in the sun, it's they've eaten, or I was about to say drank, cod liver oil, or liver oil of fish in the north. So how is it the Eskimos have good levels of vitamin D? Well, it's because they eat the livers of the very fatty fish up in the north. Unfortunately, it's very hard for them to do that nowadays because the fish carry a lot of heavy metals and pesticides tend to accumulate in the poles of our earth. So they have a problem. It's not like the good old days. But that's where they got their vitamin D. They didn't need the sun. Yes, they have 6 months of sun, but generally it's not strong enough to create a lot of body-created vitamin D. Okay? So that's the source that most people, will get into cod liver oil in a second. There's generations, by the way, that grew up having to have a tablespoon of cod liver oil every day. And it traumatized a good number of many millions of people in the United States. And that was back in 1910, 1920, 1930, perhaps even up to World War II. Okay, so I wanted you to know that. So here's another way of looking at that, is that here we have the corticosteroid, a vitamin D that has been created from the sun hitting the cholesterol in your skin, goes into 25-OH, vitamin D, which then gets converted to 125, right? We've got 125-OH, and then another kind of vitamin D. So this is what we measure in the blood. Here's a corticosteroid to be more specific, and there's a steroid. See these 4 rings? You could say that there's 4 rings, but 1 ring has been cut, right? Seco is to cut, so they cut the second ring, B. Okay, ergocalciferol. So here's the plant-based vitamin D, and here's the animal-based vitamin D. Pretty darn similar, wouldn't you say? And you can get this, and often this is what was given in doctors' offices for vitamin D. It was ergocalciferol. It's not quite as active, but it will do the job in lack of vitamin D3. And then there's the 125. Okay, we have sunlight, ultraviolet B. So think of ultraviolet B as B being better, and A not being the one you want to have, right? Okay, another rendition of how this looks. Okay, cod liver oil. So cod liver oil, this is the cod liver that we get. We have no financial ties with this in any way. You can get it on Amazon. It comes to about $2.75 per can. It's from Iceland. And so the cleanest fish in the world in terms of ocean fish are from Iceland. And the really interesting thing is that if you've ever had cod liver oil, let's say Carlsons cod liver oil, which was sold everywhere and still is, it's kind of a hard thing to have. It's pretty harsh. And you can understand why children were emotionally tortured by having to have that for their childhood. This is not that. This is equal to that, but it is really tasty. It tastes faintly like sardines, and it does come in its own oil, but it's the liver in there. And so it's such a great way of getting cod liver oil. So that's my way of doing it. That's what we have. And the only drawback that I would say about cod liver oil is that you have, of course, vitamin A, vitamin D, and the omega-3s, which are EPA and DHA. DHA is very much a brain oil, if you will. Another story, another time. But having too much vitamin A, if you're deficient in vitamin A, great, vitamin A is going to change your life. If you are not deficient in vitamin A and you start really having a lot of cod liver oil, too much vitamin A is not a good thing, and that can really suppress your immune system. So just watch the vitamin A. I'm not saying to be alarmist about it, but if you're one who takes a lot of supplements and you're doing this, you may well be over in your vitamin A. The other thing is that they were worried about with cod liver, with any liver, or fish oil, I should say, was the heavy metal concentration. As I mentioned with the Inuits, that the world is not polluted, but what that means in terms of fish is the bigger fish have a higher heavy metal content. So in my practice in the early days, we would actually remove primarily mercury from people who are tuna lovers and swordfish lovers. So the bigger the fish, and usually it's the tuna, the swordfish, shark, and a thing called tilefish, and I don't know what tilefish is, but those are 4 large edible fish. And so the concentration, the bioconcentration of heavy metals of those fish was tremendous. Let me give you an example. So if you had a nice 1 ounce piece of raw tuna, like your sushi and your sashimi, as opposed to 1 ounce of sardines that came out of the sardine can, in the very least, you would have 25 times more heavy metals, primarily ethyl mercury, in your tuna than you would in your sardines. There's very little in the sardines. And some people say actually it's more like 50 to 100 times that. So the bigger the fish, the more it is. So besides it just being a factoid out there, is that when patients would come in to me, they had to have a 7-day diet diary. So I'd see what their life was like a little bit. And so when they were tuna eaters, whether it was canned tuna or they were eating sushi all the time, I would know that the chances of whatever they're seeing me for, their chief complaints, right, whatever their issue was probably directly related to their mercury in their diet. And so we would stop them having tuna. That'd be the first thing. And the second thing is we would then chelate that out. Whole different story there too, but that was a big deal. I very much believe, and I know that to be true, so it's not a hearsay story. Looking at some actual data, real people. And so what I do is, and I haven't always done this, and I should have done this 20 years ago, but I keep a spreadsheet of all the labs, of all the clients and patients that we have, by age, date, and significance. Usually it's about how heavy they are or not. Obesity obviously is something that's epidemic in our culture, and you need to take it into consideration, but other things as well. So let's look at that. As I was saying, I wanted you to know about vitamin D, what it is, what it does, why it's important to you, and now we're going to find out how to measure this. And I want you to be comfortable with looking at labs. I know this looks like a mess, and I'll even make it even worse for you, but we're not going to go over all of this. This is just an example of labs that we do on our clients. And then we put, these are all different people, and it makes for a very interesting story when you start comparing these things. One thing I want to show you is this window here is most common out of range, OOR, labs for this group of people that we've seen over time. And vitamin D is one of them, and that's what we're going to talk about today. So vitamin D, 25OH, now that you know that, the range is 30 to 100. People ask, gosh, what's the ideal range? The ideal range varies on a per person basis. It really does. So some people say, oh, I do 100. Well, most people really don't need to be that high. In fact, I've never met really anybody that needs to be that high. But people tend to think of labs as almost money in the bank. Like, well, if I have more, it's better. No, you can get a lot of problems with too much vitamin D. You can have heart conditions. You can have bone growth for lack of bone spurs, joint problems. And so you need to be within a comfortable range, whether you want to call it the sweet spot or not. I would say if there was a sweet spot, I look at 75 primarily. We did have one. But what I want to show you is in this range of numbers of people who have been in our programs, quite in a range, that not everybody feels that vitamin D is a big deal in their life. And this has to do with some of the stupid, in my view, studies that are done out there saying, no, vitamin D didn't change anything on these thousands of patients that were X. Well, the problem is when you have large numbers of people you're studying or looking at their vitamin D levels, is it obscures the extreme minority of low levels. So though most people here would not say, I got my vitamin D range up a little bit, it made a big difference. No, they'd say, I didn't really notice anything. However, there's a couple people here, the one that has a 7 and the one that has a 10, would find it, wow, their life was changed. This person specifically, depression disappeared, their vertigo disappeared, their joint pain disappeared, their sense of sleep, or much better sense of, not sense of sleep, much better sleep, quality of sleep. So the point is, if you're deficient and you take vitamin D or go get the sun, get your levels up, however that is that you're going to do it for yourself, it'll be remarkable. You'll go, oh my gosh, look what I discovered. That story, your experience, may not be transferable to somebody else. You know, the person who's 75 has a 25OH level of 75 really isn't going to appreciate your story much. And so that's why levels do indeed count. Before we leave this blinding number of labs here, I just want to mention the row above in terms of also in the box of most common out-of-range labs is homocysteine. And here higher is worse and lower is better. So you can see the red ones I put in for a quick eye reference to there's probably what at least in the purple are borderline out of range. So you have at least 50% people, if not more, have a problem with homocysteine. Homocysteine is a whole separate conversation, and it's a fascinating one, but we're going to get that in another day. But I'm going to end up talking about a study here today about these two. Okay? Okay. So if you need it and somebody gives it to you or you take it for yourself, it's going to be extraordinary. If you don't need it and you take it, it's not extraordinary. And perhaps, especially with vitamin D, that you can take too much and it can be detrimental. So knowing your numbers, knowing your levels is important. Now the next thing I want to add is that it is known that there are a number of genetic polymorphisms that have to do with vitamin D. That means they're kind of semi-benign mutations, which means these people need more vitamin D because they have a tough time processing it. I know it gets into genome and so on and so forth, but it's easy enough to find that out. You know, it's not esoteric or secret information or you need to go find somebody special, but that's it. So you look at their numbers. You have to go to your labs, get your labs. What are your actual current levels of 25OH? And then if for some reason you're just not feeling great, then vitamin D still seems to be an issue. You can check to find out what your polymorphisms are. And there's a whole cottage industry now that's created around the idea of looking for these SNPs, single nuclear polymorphisms, these benign mutations that I tell you about or I reference. And you get reports on these and you can do it pretty easy. You can get it from 23andMe, the raw data, and send it over to any one of 20 or 30 companies now to get this done. That's another story. I think it's valid, but I'm just giving you a little piece there saying that vitamin D could be an exception. There are people that have a tough time actually utilizing vitamin D. They better get some sun. All right, I'd like to end there because the misinformation that's out there was that vitamin D doesn't do anything. Well, it depends who you are. It depends what your need is. Yes, it doesn't do anything additional if you're doing fine. So there was a YouTube out there that one of my patients brought to us that I thought was kind of inflammatory and misguiding people. The other is, it's not an issue whether it's a hormone or vitamin. Get over it. It's just not, it's important. That's the important thing, is important. You can have too much. And let me see, I have some points here. Oh, there is, I do want to go back and say, these are some of the labs we take. Notice this one, homocysteine. That's a whole nother talk we will have. Happens to be right above vitamin D. But this is under an area for me in my labs as I'm accumulating them on people. It says the most common out-of-range OOR, out-of-range labs. And so I list these. And so you have triglycerides, HDL, IGF, insulin, CRP, glucagon. But on that list, homocysteine. So why did I just say that? It's because just 2 weeks ago, there was a study that showed that vitamin D given to those who had elevated homocysteine, and for people who were deficient in vitamin D, did you catch the deficient in vitamin D? That bringing their numbers up to something reasonable, 50 to 100, brought their elevated homocysteine down to a nearly normal level. So that's remarkable. So it affected an entirely different category of labs, homocysteine. Another story coming. So till next time, take care.